Hello and welcome to the new patient orientation video. I'm going to do a brief presentation and an overview of each of the services that we offer at our clinic, and this video is really meant for anybody who's planning to come in as a new patient or anyone who's even considering coming as a new patient to our clinic. I'll give a brief explanation and description of the therapies that we utilize, and I'll give some examples as to how we would utilize them in specific cases. We provide integrated healthcare services, and we have a combination of therapies such as joint manipulation, deep tissue massage, whole body cryotherapy, photobiomodulation and laser therapy, clinical nutrition and functional medicine, and we also have Dr. Pott, who is our only specialist in the field of functional neurological rehabilitation for children with learning or behavioral disorders such as dyslexia and autism spectrum disorders in general. I'll start by discussing just the first therapy we ever offered. We've been doing this for over 20 years, and that would be classical chiropractic care or joint manipulation therapy. The basis and the underlying premise behind doing joint manipulation is fairly simple. We're looking for abnormal movement. So that would be biomechanics, meaning the function and movement of all the joints of the body. So we do an examination and we look for abnormal biomechanics, which is, again, abnormal movement in the joints. So very often we're looking at the joints of the spine and the pelvis and the hips and knees, shoulders, etc. And we utilize manipulative procedures to correct for those abnormalities when possible. And this typically will alleviate pain in the muscles and joints and leads to ease of movement, and it makes it easier to perform routine daily activities, whether that is sitting behind a desk for 8 hours a day or working in more of a laborious scenario on a factory floor or whatever the case may be, as well as just doing yard work, playing golf, and playing with your kids and grandkids, and just all the activities that we all do of daily life. Musculoskeletal pain is nearly ubiquitous. The vast majority of adults in the United States are going to experience things like neck and back pain at some point in their lives. And a very large percentage of people are dealing with these things on an ongoing basis. And chronic pain is an absolute destroyer of quality of life. So this is the thing that's kept chiropractic really alive for thousands of years. It wasn't called chiropractic thousands of years ago, but Hippocrates, the father of medicine, wrote the first text pertaining to spine manipulation in 400 BC. It's been around for all of that time for the simple reason that it's very safe and very effective, especially when it's done properly. And so we have 4 doctors at our clinic that have all been thoroughly trained and very experienced in a multitude of techniques pertaining to muscle and joint manipulation. And we bring all of our skills to bear when it's appropriate, when we see that people have musculoskeletal pain or other dysfunctions, and it can be alleviated by manipulative therapy. We'll use a variety of techniques for really people of all ages to get the fastest and simplest and gentlest therapy to them, so we can correct the problem and quality of life improves. We often combine joint manipulation with deep tissue work, and usually this is trigger point therapy or myofascial release and a variety of other soft tissue procedures like active release technique, for example. And what we're looking for is the abnormal joint function or abnormal posture. If they've been present for a long time, inevitably the muscles will become abnormal in their function as well. This usually results in muscles that are too tight and quite often very sore. Sometimes people don't even realize that they have particular muscle-based pain until we sort of bring it to fruition during our examination. So we oftentimes find trigger points and adhesions in the muscles that need to be released in order for long-term postural or biomechanical function to be corrected. Another therapy that we offer in the clinic, and we often use it as an integral part of an overall treatment plan, is whole body cryotherapy. Many people are becoming familiar with whole body cryotherapy nowadays because of popularization on TV shows like Dr. Oz and The Doctors and Ellen and so on. It's also been seen by many people on sports stations like ESPN because it's become very popular for professional athletes to use to recover from injuries and even prevent injuries and even enhance performance. The primary reason that we use it is we've found really from the beginning, 20 years ago, that there's a significant percentage of people that don't recover well from physical therapies, whether it's traditional physical therapy or chiropractic care or what have you. And very often, most often really, the primary reason for people to take long to recover or not recover at all is because they've got issues with significant systemic inflammation. This is often easily measured and documented on simple blood testing, and sometimes it's also very easy to tell even without laboratory testing because of just widespread pain in multiple joints, particularly conditions like rheumatoid arthritis and fibromyalgia and things of that nature. Whole body cryotherapy is very interesting as a therapy in that it has a systemic effect, meaning it affects the entire body. It was originally developed in Japan for the purpose of treating rheumatoid arthritis, and it's been proven in peer-reviewed medical literature to powerfully suppress the pro-inflammatory signaling molecules in the body called cytokines that are responsible for triggering the inflammatory response. And it even boosts anti-inflammatory cytokines, which all kind of work together to get rid of pain and inflammation anywhere it exists in the body. There are some pilot studies, smaller studies, that are very encouraging at this point that show improved brain function and cognitive function, even mood elevation in depressed patients. It improves gut function and the gut microbiome, which is the 3 or 4 pounds of bacteria that we have residing in our intestinal tracts that is involved and related to every single physiological function in the human body. And kind of one of the nice side benefits of cryotherapy is it increases brown fat, which is technically called brown adipose tissue, and that changes our metabolism in many ways, but it in essence makes it easier to burn fat as a fuel source, and therefore it can be used as part of an overall strategy for weight loss and fat loss specifically. It's been proven effective in reducing inflammation anywhere it exists in the body. So even a person after a concussion, for example, would have inflammation in the brain. Even though your head is not in the cryo chamber, as you can see in the previous photo there, it still massively suppresses inflammation in the brain. So even a person, say, with a broken wrist can stand in the chamber with their hand elevated above the chamber and not being exposed to the extremely cold air, and there will still be a very significant clinical effect. So the way it works, and you can see the chamber there, is you step into the chamber with gloves and slippers on, and then the operator elevates the floor so your head is above the rim of the chamber. So you're breathing room temperature air, and your head and face are not sort of exposed to the super cold air. It's a 3-minute therapy using liquid nitrogen cooled air. So the air temperature in the chamber will drop to approximately, sort of average off at about minus 200 degrees Fahrenheit, which sounds extremely intense, and it sounds like it would be quite a miserable experience, but it's really not. The air doesn't have the thermoconductive effects of cold water, so it's really not even as bracing or as shocking as jumping into a cold swimming pool. Typically the last minute is where people are really feeling cold, because the blood starts to be shunted from the arms and the legs back to the core as the body is starting up the machinations of the hypothermic response. And that's really the design, that's by design, and that's the purpose of the therapy, because when the body is preparing for hypothermia, one of the things that's been long observed is this massive suppression of inflammation anywhere it exists in the body. So there's also some immune hardening, meaning that your old and damaged immune cells get sort of trashed, and you trigger the development of new ones from the thymus gland and the bone marrow. And so there's a variety of side benefits, but the primary reason that we use it clinically when needed is for patients that are dealing with high levels of inflammation throughout the body. And that would really dramatically slow down their progress from the physical rehabilitation techniques like manipulation and deep tissue work. And it could even preclude them from getting better at all. So very often when they're experiencing excessive inflammation, they'll recover in as little as 10 sessions over 2 weeks. So it's typically Monday to Friday for 2 weeks, 3 minutes a day. Most of the research that's published in major medical literature is done on the basis of 10 sessions. And that's not arbitrary. That's just what's been observed to be typical for people to reach a clinical threshold, meaning a significant reduction of inflammation. And we observe this all the time on pre and post blood chemistries, and of course symptomatically. People feel a lot better sometimes right after the very, very first treatment. It's not unusual for us to have folks come in and have their first session and wake up the next day without pain. It's quite remarkable in that regard. So we will often use this in people that are injured and recovering from their injuries, or people with chronic pain due to chronic inflammatory processes. It's extremely safe. There are a few contraindications. We do not do cryotherapy on people with really high blood pressure. We do not use cryotherapy on people that have atrial fibrillation, have a pacemaker, or if they have Raynaud's phenomenon. And that's pretty much it. We have seen patients with all of those conditions, and that does prevent them from being able to benefit from cryotherapy, but that's really it, and that's a pretty small percentage of people. Otherwise, it's actually very easy to do. It's really easy to tolerate. I think out of the hundreds of people that we've done cryotherapy on, we've only had a few that found it too difficult to tolerate the cold temperature for 3 minutes. But we've had people from childhood age to well into their 80s, and the vast majority of all people tolerate it very well and see very significant benefit from it. It's really been a key factor in a lot of people recovering from our therapies where they've tried and failed before in other clinics, because if there's a significant inflammatory issue standing in the way, then they tend not to be able to recover from physical therapy or chiropractic care, where we might have a person in that situation do 2 weeks of cryotherapy and then receive, say, joint manipulation and deep tissue work, and they do extremely well. And it's because we put the fire out first, and we kind of created a situation where they're able to receive the benefits from the other therapies and they're able to recover. Another therapy that we offer and that we probably nowadays utilize more than any other therapy is photobiomodulation. And that is a bit of a mouthful. It used to be called low-level laser therapy, and up until about 5 years ago or so, it was in the medical literature referred to as photomedicine, phototherapy, low-level laser therapy, cold laser therapy, and others. And several years ago, the World Alliance for Low-Level Laser Therapy came together and decided on this term, photobiomodulation, which was settled upon because we're using photons of light that are modulating the metabolic activities of living tissues. So photo is from photon, bio just means living tissue or life, and modulation means that we can increase or decrease cellular metabolic activities in any cells or tissues or organs depending on the dose that we deliver. So the most remarkable thing about photobiomodulation is the fact that it actually facilitates repair and heals tissues that are injured or degenerating or inflamed in any way. And it does this independent of oxygen and glucose availability. That is also quite an extraordinary fact. For example, if I tied a tourniquet on my arm and kept it there and I cut my hand would not heal until the tourniquet was removed, and it wouldn't heal because there's not enough blood perfusion to the tissues for that healing effect to occur. But if I still had my tourniquet in place and I used my therapeutic laser, the wound would heal, despite the fact that there is a loss of blood and oxygen perfusion, or oxygen and nutrient perfusion. So it reduces inflammation and facilitates healing and repair in any and all tissues that have ever been studied. It mitigates the effects of aging, which is a grand statement, I know, but it's actually true. I hate to use the term anti-aging because it's been so abused over the years, but if there was any therapy out there that truly could be considered anti-aging, it would be, full body photobiomodulation. There are now well over 500 randomized clinical trials, so those studies meet the gold standard in medical research. There are over 5,000 studies in total, going back over 30 years on animals and humans. And maybe my favorite thing about photobiomodulation is there are no side effects that have ever been reported. There are no contraindications. So you can have artificial limbs, you could have pacemaker, you can be on any kind of medication, and it does not prevent you from being able to benefit from the photobiomodulation therapy. And for that reason, it immediately became, my favorite therapy that I've ever been exposed to or ever used with patients clinically. It's quite extraordinary. We can apply it with handheld units that you see there in the photo. We have a variety of different applicator probes that are used for a variety of different reasons, depending on the tissues we're trying to treat. For example, if we're treating a carpal tunnel syndrome, we're going to use a really low dose and low powered photobiomodulation probe. If we were going to treat, say, a lumbar disc herniation, we would use a much higher powered, much more concentrated dose using a higher powered photobiomodulation probe. And that's sort of the art part to it. There's a bit of nuance in doing photobiomodulation therapy. It's not just sort of pointing a laser at someone's injured tissue and that's that. We have to be very specific in the dosage that is applied. It's called a biphasic dose response, meaning that if we provide too little energy in the form of measured in joules, then there's no therapeutic effect. And then if we provide too much, then there's no therapeutic effect. And the depth of the target tissue that we are aiming for dictates, what kind of dosage is required on the surface of the skin. For example, as I mentioned, the carpal tunnel syndrome, or say a tennis elbow where the inflamed or injured tissue is very close to the surface, the therapy literally takes 2 or 3 minutes in terms of dose application. Whereas if it was, as I mentioned, a lumbar disc herniation or say an arthritic hip joint, it's going to take more like 10 to 15 minutes at much higher power because of the loss of potency traveling from the surface of the skin to the deeper tissues. We also have 2 full body photobiomodulation applications. You see here the Novothor. We actually currently have the only Novothor in the state of North Carolina, and it is the first on the market, and it's one of the most remarkable new technologies in healthcare, in my opinion, that's come along in my 20 years of practice. Again, no side effects, so we can use this on any individual, and really anybody with any inflamed tissue or any degenerating tissue, which is to say anyone over the age of 40, benefits from this. There's a lot to sort of get into in terms of the technical aspects of how it works, and I instead did that in another recording that's just a purely photobiomodulation presentation. But for the purposes of just this orientation video, just suffice it to say that we would use this on just about any patient that has arthritic changes, tendon tears, ligament sprains, disc herniations, etc. Also, all the recent research that's being published on transcranial effects of photobiomodulation are all coming back very, very positive for brain function, even mitigating disease risk for Alzheimer's and Parkinson's and traumatic brain injury and post-stroke rehabilitation, etc. And there's even very positive research of late on depression and anxiety and even suicidal ideation and so on. There's nothing negative out there in the medical literature pertaining to photobiomodulation, and just in the last few years, the research has been gaining a lot of momentum. There's quite a large volume out there, and continues to be. I think in the year 2018, so last year at the time of this recording, there were on average about 30 studies a month published in peer-reviewed medical literature. So just over 360 studies for the year of 2018, and 2019 looks like it's going to be about the same. Some of the basics of how photobiomodulation works are worth covering. So we have these molecules which absorb light called chromophores, and the stimulation of chromophores in our mitochondrial membranes induces the production of cellular energy, which is called ATP. So inside of our cells, we have mitochondria, which are like the battery of the cell. That's the energy producing part of the cell. And on the inside of those mitochondria, we have these chromophores. And if you can deliver enough photons to those cells, you can activate those chromophores to activate energy production on a cellular level. And of course, for cells to recover and repair from injury or degeneration, etc., ATP production is the basis of that. If the cells are incapable of producing ATP effectively or efficiently, then healing is sort of out of the question. This little diagram, or this little graphic, kind of shows that happening, where you see a picture of a laser on the surface of the skin, and it shows it penetrating the cell, and they talk about specific wavelengths like 670 nanometers, 808 nanometers, 904. These different wavelengths have different effects. 8 to 820 nanometers, like usually about 810 nanometers, those are used for the deepest penetration. You know, the 600 range is more skin and just under the surface of the skin. But the point is, if you use the appropriate applicator, the appropriate laser or LED diode applicator, depending on what we're treating, we just want to deliver the appropriate dose. And as this diagram shows, you have this enzyme called cytochrome C oxidase that's dramatically affected by this activation of these chromophores. So as the graphic indicates, the light enters the cell's mitochondria and is absorbed by the chromophores, including the protein cytochrome C oxidase, which then increases its activity. As a result of this heightened activity, 3 molecules are affected. That's ATP, or energy, reactive oxygen species, which is from oxidative stress, which is the kindling for all inflammation and the process of aging, and nitric oxide. So as a consequence, we see ATP production go up, so energy production on a cellular level goes up, and the cell's ability to fight infection and heal is restored. And then we see the modulation of reactive oxygen species, so therefore oxidative stress is mitigated because we promote the cell's ability to extinguish that. And then it releases nitric oxide from the enzyme, and that increases circulation. It's a signaling molecule, so it signals the need for more blood and oxygen. So increased blood flow, decreased inflammation, and it enhances the transport of oxygen and immune cells through the tissues. Essentially, photobiomodulation is a mitochondrial therapy. And mitochondria dysfunction can be caused by environmental toxins that we're all exposed to, in air pollution and water pollution, and just even pollutants that we find in everything from our furniture to our dry cleaning to etc. And stress and food-based toxicity, that all of that interferes with the production of ATP on a mitochondrial level. This loss of energy starves the cells and increases the rate of cell death, which is called apoptosis, and the cellular damage cascades down into the tissues, organs, and all the systems of the body. I put this particular study in here because I think this is the most, to my eye, I think this is the most dramatic example of the power of photobiomodulation. And as you see, the name is called Shedding Light on a New Treatment for Diabetic Wound Healing, a review on phototherapy. So this is before photobiomodulation was the established terminology. So this is from 2013. And here's a quote from that study. And it says, impaired wound healing is a common complication associated with diabetes with complex underlying mechanisms and often necessitates amputation. With the advancement in laser technology, irradiation of these wounds with low-intensity laser irradiation, which again is PBM or photobiomodulation, has shown a vast improvement in wound healing. At the correct laser parameters, PBM has been shown to increase migration, viability, and proliferation of diabetic cells. There is a stimulatory effect on the mitochondria with resulting increase in ATP. In addition, photobiomodulation also has anti-inflammatory and protective effect on these cells. In light of the ever-present threat of diabetic foot ulcers, infection, and amputation, new improved therapies and the fortification of wound healing research deserves better prioritization. The reason I think that's so astonishing is what they're finding is people with severe diabetes who, for example, maybe have a minor wound on their foot that turns into a major problem because as a consequence of, say, long-term escalation of blood glucose and the damage that causes to the microvasculature, the tiniest arteries in their extremities, so in this case their feet, that then damages the nerves and they get peripheral neuropathy and that sort of thing. Well, it's the compromised blood perfusion into the feet that has resulted in this minor wound that may now be leading to the loss of that foot. So it's, you know, a very serious and dire situation. And just like my tourniquet example from earlier, that's why I use that example, because that's what this is showing, is that even though they have massively compromised blood perfusion, so getting oxygen and nutrients in order to heal a wound, just simply applying a therapeutic laser or photobiomodulation probe enhances the circulation to the point that you can heal these wounds and avoid foot amputation in this example. So I use that as sort of a fundamental thing, because if it can do that for tissue that's in that much trouble, then what do you think it can do for an arthritic knee or a disc bulge or, you know, what have you, frozen shoulder, rotator cuff tears, etc., etc. And the results are absolutely astonishing. And again, no side effects, no risks, and it's usually fairly fast acting. Some people go through as little as 4 weeks of therapy at maybe 2 times a week, to maybe 12 weeks of therapy at 3 times a week, and that's, you know, kind of the two ends of that spectrum. It just depends on the condition we're treating and the overall health of the person that we are treating at the time. This is not an exhaustive list of conditions that are positively impacted by photobiomodulation as per the literature. And you see the usuals like arthritis, tendonitis, bursitis, plantar fasciitis, rheumatoid conditions such as lupus, scleroderma, Sjogren's, etc., muscle, ligament, and tendon injuries like sprains and strains, depression and anxiety, migraine headaches, peripheral neuropathy, and fibromyalgia, which is usually profoundly impacted by full body photobiomodulation. It's, again, in my estimation, you know, the most exciting therapeutic application to come along in my 20 years of practice, and it's something that I've been very excited to be able to offer to patients just in the last 3 years that we've been able to offer that in a clinical level. So just to pause and give you an example, now that we've talked about, you know, a few of these therapies, if a person was coming in with, say, neck and back pain, which is, you know, super common and very common in chiropractic clinics and physical therapy clinics, if they had systemic inflammation, we would start them in cryotherapy to put out the inflammatory fire, so to speak. And then we would transition them to photobiomodulation to actually heal the tissue and halt the degenerative change. See, cryotherapy is very powerful as an anti-inflammatory, but it doesn't heal anything. And spinal manipulation, joint manipulation, muscle work, these are very powerful therapeutic tools to correct for biomechanics and to, you know, alleviate pain in muscles and joints, but it really doesn't heal anything. And photobiomodulation is extraordinary in that regard, in that it actually does facilitate healing. So that's an example of where we would use all 3 of those therapeutic interventions in a particular case. If a person's not significantly or severely inflamed, at least on a widespread level, like full body inflammation, then we can skip the cryotherapy, use photobiomodulation and some hands-on manipulative therapies to bring about a much faster correction that lasts a really long time, or of course ideally is permanent. And without photobiomodulation, that would not be possible. And it's our opinion at our office that, you know, it's every chiropractic clinic, every physical therapy clinic should be using full body photobiomodulation as an integral part of their therapy. It doesn't make sense not to, because everybody recovers faster and better when you include photobiomodulation as compared to when you don't. And it ends up saving people a lot of time and a lot of money because they get faster results that last longer. There's just zero downside to doing it. And in fact, even if we're treating somebody for, say, arthritic knees or some back pain or what have you, by using full body photobiomodulation, they always get massive side benefits, right? So a lot of therapeutic value is sort of baked into the cake there, and they're going to be improving things that they didn't even know needed improving. And that's the beauty of photobiomodulation, which is sort of, irrefutable. Another service that we added to the practice about 18 years ago is functional medicine or clinical nutrition. Kind of goes by either name. Nowadays, functional medicine is typically the term that's used to describe the service. It's a systems biology based approach that focuses on and addressing the root and the cause of disease or even just dysfunction. Each symptom or diagnosis can be one of many contributing to an individual's illness. So we use dietary strategies, lifestyle design, and nutritional supplementation to address the underlying causes of each individual's condition. In other words, this typically is laboratory test based. So blood work and hormone panels, stool analysis, toxicology assessments, and whatever the case may be, we will utilize laboratory testing to seek out the underlying mechanism of dysfunction that's leading to a person's ill health. And it can be really, really simple in many cases. A lot of the people that we see that have been struggling for a long time and have tried and failed at lots of other clinics and other therapeutic interventions, sometimes we find the simplest answer just by looking at basic blood chemistry. For example, anemia is a really common thing that we find in people that are chronically ill or dysfunctional. And if you're anemic, if you have iron deficiency anemia, or say pernicious anemia, which is B12 deficiency, or if you're vitamin D deficient, you're not going to get well from anything, any therapeutic intervention. No drug is going to work like it should. No therapy is going to work like it should. In other words, you don't have the capacity to heal. And so, which has always been striking to me, over and over, with thousands of patients, over the last 20 years, and been doing functional medicine for 18 years when it was just called clinical nutrition or integrative medicine. And it's still sort of shocking to us how common it is for people to come into the clinic that have been struggling for many years with a variety of different health conditions. And we find these really simple deficiencies that have never been found before. Nobody ever looked for these things before. And in that case, all we do is correct the deficiency. So if they need iron, we give them iron. If they need B12, we give them B12, etc. It can be a lot more complicated, and oftentimes it is, with thyroid dysfunction, adrenal dysfunction, hormonal imbalance. These things are a little harder to address, but they're all addressable. And in the vast majority of cases, we can facilitate recovery in people that have these complex metabolic disorders. Right from the Institute for Functional Medicine, this graphic is right from their website, and I think it's a really good one to give people an idea of the thought process that goes into overall holistic approach, which is a functional medical approach. So on the diagram on the left, one condition, many causes, they're using depression as an example, and that can be caused by any one of those factors that you see there, like an omega-3 fatty acid deficiency, which is most people in America have a pretty significant omega-3 fatty acid deficiency. And that can cause all kinds of problems related to chronic and systemic inflammation. And so that could be the cause of the depression, could be low thyroid, could be vitamin D deficiency, it could be that they're pre-diabetic and they're having like sugar spikes and insulin surges that's throwing off their hormones and neurotransmitters. And we could add gut dysfunction to that. That's now a known cause of depression, is intestinal overgrowth with bacteria or fungus. And it could be due to antibiotic use. It could be all of those things. It could be one of those things. And so, and there's many other factors that play into that. That's not an exhaustive list of causes of depression. But the point there is that you have multiple causes to look for, and we need to look at everything to make sure that we've covered all the bases. And then the graphic on the right, you see one cause, many conditions. So just chronic inflammation that I mentioned before is unbelievably common in our patient population. And that can lead to depression, heart disease, arthritis. You could also put bursitis, tendonitis, plantar fasciitis, all the itises on there, cancer, diabetes, heart disease. So chronic systemic inflammation is a huge deal, and that's why I like the fact that they use that in this particular graphic. And that goes kind of back to the cryotherapy and why we brought that in, because that just dealing with inflammation, the cryotherapy is a way to quickly suppress it. And very often inflammatory conditions are self-perpetual. They're self-propagated and self-amplified in many cases. And in many times, all we need to do is break the cycle of inflammation, and it stays broken. So, we won't typically just use cryotherapy. We would use cryotherapy and clinical nutrition, like curcumin and resveratrol and omega-3 fatty acids and boswellia and on and on and on. So there's a variety of anti-inflammatory approaches that we can take using nutritional supplementation. And when we do that in conjunction with photobiomodulation or whole body cryotherapy, it's a very powerful arsenal that we have to deal with this problem that's so pervasive and underlies so many conditions that affect so many people. And it's totally accurate to say that the vast majority of people that end up coming into our clinic are there with a variety of different conditions, but the vast majority of them, it's tied to this chronic inflammatory state that they've been trapped in. And that's why we use these tools, so we can bring a multifaceted approach to the problem and sort of win the game, so to speak. We can overwhelm the inflammatory response and put them back into an anti-inflammatory state. Another service that we offer that is extremely unique is Dr. Pott's Brain and Behavior Program. Dr. Pott is one of a very small group of elite doctors in the country that are trained in this fashion and trained in this type of therapeutic interventional program for kids that are dealing with learning or behavioral disorders. As I mentioned earlier, dyslexia is a common one, attention deficit hyperactivity, the full autism spectrum. And it's something that is quite extraordinary, and it's quite complex. And so it absolutely deserves its sort of own treatment in a separate presentation to go through the science behind it and the mechanisms that are in play. But for the purposes of just an introduction and an overview, I'll just kind of give you the broad strokes. Dr. Pott first became a diplomate with the American College of Functional Neurology, and she completed their program in childhood developmental disorders. And she started applying these therapeutic applications and these examination techniques to kids with learning and behavioral disorders many years ago, and really has changed the lives of untold number of kids and their families by extension. And her results were really good, but she was finding that she was getting about 70% success rate, and maybe 75%, and that was good, but it wasn't good enough for her. So she actually furthered her education, and she got a second certification in neurophysiological psychology. This just gives you an example of the curriculum through the functional neurology program, where they go through extensive examination procedures for the newborn child and adolescent. There were 2 modules on just attention deficit hyperactivity disorder, then developmental dyslexia and learning disabilities, autism spectrum disorders, nutritional, dietary, endocrine, immunological considerations, and neurobehavioral disorders, behavioral considerations in children with neurobehavioral and attachment disorders. That's where she started. And then she added neurophysiological psychology training through this INPP program, and she combined the skill sets that she obtained through both those programs, and now her success rate is above 90% and faster and better, and it's really quite extraordinary. The whole premise is based upon the fact that for a variety of reasons that we don't have time to get into in this orientation video, kids can retain these things called primitive reflexes. So we're born with these things, these primitive reflexes. That's actually part of what gets us positioned properly in the womb and moves us properly through the birth canal. And through the first year of life, and as the brain is maturing, these infantile or primitive reflexes should be stifled successfully after the first year or so of life. And for a variety of reasons, like chronic stress or dietary issues or whatever the case may be, infections and exposure to antibiotics, things of that nature, then some kids can retain these infantile reflexes, and they cause changes in brain function that manifest as behavioral disorders or learning disorders. This is just a partial list as an example of some of those infantile reflexes that she looks for through her examination procedures. And when she finds that these things are present in kids that are 5, 6, 7, etc., and older, that's never normal, and it's never okay, and they result in these dysfunctions that manifest themselves as learning or behavioral disorders. So once she finds that these particular reflexes are present, then there are specific rehabilitation techniques that are just based on specific movements, body movements, and some other stimulations that will activate the areas of the cortex in the brain that are supposed to be stifling these infantile reflexes. And so she can change the brain in such a way that it successfully and properly stifles these primitive or infantile reflexes. And then the manifestation of that is a very dramatic, in many cases, improvement in behavior and learning abilities. That is an entirely unique thing to our area, and there, as I said, a small group of fairly elite doctors in the country that are trained this way, and it's something that we've been really proud to be able to offer to our community, and really excited at seeing the changes that take place. It's hard to exaggerate the impact that has on a child's life and their future, and of course it brings a lot of comfort and ease to the parents and the family members, even by extension. So if you have a child or a grandchild or what have you, or you know a child that has some of those issues, then I would absolutely encourage you to contact the office and schedule them with Dr. Pott for her super intensive examination and by all accounts, benefit from her skill set. So just wrapping up, I'm going to give you a few case examples just to show you how we would apply these different therapeutic services that we've covered now. So here's a really simple one, a case example: a 30-year-old male with recent onset lower back pain. He doesn't have any weakness, numbness, or loss of reflexes in his lower extremities, so there's no red flags there. That we're not talking about compressed nerves or spinal cord impingement, that sort of thing. The physical exam reveals that he has a loss of range of motion in his lowest lumbar vertebra, which is the most common one for back pain, and excessively high muscle tone on his left side. He's an avid golfer, plays almost every day, and or at least practices every day, and so because he swings with all of his power to the left, he's developed a muscle imbalance that's changed the range of motion in the lower lumbar joints in the back. So it's a really, really common kind of example. And in his case, the pain was resolved with just spinal manipulation therapy after 4 treatments, 2 times a week for 2 weeks. So that's just an example of a really easy case where we don't need to bring all of our therapies to bear on this kind of a case. This is really simple, and we see these things all the time. And typically, so lots of people that come in, they're in and out of there in 2-3 weeks, and the problem is resolved. And of course, we would give him simple exercises to do long term to keep him from needing coming back to the office, and to just keep those lower lumbar muscles balanced. Another case, a little more complicated, a 55-year-old male with chronic neck and lower back pain, frequent headaches, and arthritic knees. He came in with x-rays that were already performed, and they revealed a moderate degree of degenerative change, that's arthritis, in his neck and lower back. And we ran blood work and found that he had low vitamin D, low B12, and elevated C-reactive protein. I'll pause on that because C-reactive protein, in my opinion, is the most important blood test that you can have. That should be, if you've never had yours checked, you should ask your doctor to do it or have us order it for you. But C-reactive protein is the most sensitive measure of systemic inflammation, and recent research has shown that it's the greatest predictor of longevity. It's the greatest predictor of like heart attack and stroke risk, diabetes risk, dementia, and cancer, and so on. So but the point here is that he's inflamed systemically. So elevation of C-reactive protein means that you have a significant amount of inflammation going on in your body. So in this case, we did 10 cryotherapy sessions over 2 weeks. That's almost every study, as I mentioned, that's been published, uses that as a standard course of treatment. And then we did 10 spinal manipulation treatments over 5 weeks, so twice a week for 5 weeks, and we coupled that with photobiomodulation, which is, again, the laser therapy each time. So we would treat his neck, lower back, and knees with our therapeutic lasers, and then we would do spinal manipulation to restore normal joint range of motion and some deep tissue work to restore normal muscle function. We supplemented him with vitamin D and B12 because he was deficient, and omega-3s, fatty acids, because they're anti-inflammatory, and turmeric, which is just a simple but super effective anti-inflammatory agent from nature. And he had full resolution of his pain and improved ability to perform activities of daily living just over that amount of time. So pretty simple, but the point here is to illustrate the fact that if this fellow just walked in to, say, the majority of chiropractic offices or physical therapy offices, and they did not look at his blood work or biochemistry, he would not have gotten better at all. And the reality is that you could adjust and do manipulations on this fellow for probably 6 to 9 months, and you would get significant pain relief, but it would come back as soon as he stopped treating. And in a lot of cases, this is where, in our opinion, chiropractic clinics, for example, fall very short, because if they ignore these other factors and they don't have these other therapeutic tools, it takes a really long time. It ends up becoming very expensive and time consuming, and then the patient can never stop treatment without pain coming back. And that's just not the best care, right? When you have these other tools that are available, and when all it takes is a simple, in this case, $50 blood test, and of course would cost nothing with anyone with regular insurance, we can find out that there's this metabolic issue. In other words, these deficiencies in play, and he's inflamed. So we can use our tools to extinguish the fire, so to speak, put out the inflammatory response. We can sort of correct those deficiencies, and now he's responsive to the hands-on treatment in very short order, and it'll be long-lasting results. His pain doesn't return when he stops treating. So it's the difference between actually fixing a problem and just relieving it somewhat, and that's always what we're after. Another example, a 57-year-old female with fibromyalgia, chronic fatigue, migraines, hot flashes, insomnia, and irritable bowel syndrome. I use this as an example because this is where we'd bring all of our tools to bear on this person, right? So lab testing reveals systemic inflammation, elevated estrogen, low progesterone, so they'd call that an estrogen dominance, elevated liver enzymes, so she's not able to clear the estrogen appropriately, and who knows what else. So biotransformation is the technical term for detoxification, and that's impaired. She had low vitamin D, low iron, and abnormal thyroid hormone conversion. In this case, it was the hormone conversion that takes place in the liver, converting the T4 thyroid hormone to T3. So 10 sessions of cryotherapy, again, over 2 weeks to put out the fire, nutritional protocol to correct for all those abnormalities we found in the blood work, and 24 sessions of whole body photobiomodulation over 12 weeks. So it was twice a week for 12 weeks, resulted in full resolution of symptoms. This is a classic example, too, where it takes a little more time and it takes a little more effort, and we use multiple therapies, but we're able to at least address the underlying causes of the problem and not just cover it up. And that's always, again, what we seek to do. And so, drawing to a close here, if you decide to come into our clinic as a new patient, this is, what you can expect. And I like to make a point of the fact that we don't use cookie cutter approaches to people's health. I think that's unethical. I don't think it's even viable. I wish there was a good cookie cutter, and maybe there is, and I'm not aware of it. But at this point in time, I've never seen anything that's legitimate and that works like a one-size-fits-all approach to health. It's highly individualized. People come walking in with their own unique sort of, it's like a fingerprint. It's unique to them. They have similarities across the board, but we look at every case as an individual case, and we don't try to fit people into our program. We try to fit the program to the person. So our typical process is you'd contact the office and you'd fill out the new patient intake form, which you'll notice is quite extensive. It's probably the most exhaustive and extensive intake form you've ever seen. The reason for that, hopefully by now is clear, is that we don't want to miss anything. We don't want to start therapy and not have all the information, and we don't leave any stone unturned, so to speak. So we'll do a thorough history, an examination to ascertain the underlying cause of your health issue, and recommend a course of treatment that should give you the best result in the shortest period of time at the most minimal cost to you. That's what you can expect every time. We always tailor-make our recommendations to each individual person. If we feel that you need treatment at another clinic, we will make the referral and explain the reasoning behind it. So sometimes we like to figure out what's wrong, but then we're not the best place to be, and we will refer you to another clinic, another doctor, or whatever the case may be. Sometimes we can play a role, but we know that we are not going to be able to cover all of the bases, and so we will treat or co-treat with another clinic or doctor's office. And again, we'll explain the reasoning behind that when we do that. And if there are financial constraints, we offer interest-free financing through CareCredit. So a lot of people will, if they need a more extensive care plan, like even that third case that I just mentioned there, and sometimes we have even more complicated cases, or people that have chronic conditions that can't be cured, for example, rheumatoid arthritis like lupus. So we want to do our best to maximize your improvement and mitigate the symptoms and the pain, but that's not easy, and it's going to take many months in some cases to get to maximum improvement level. So for those cases, CareCredit is pretty popular now. Doctors' offices of all kinds, including dentists and medical doctors and chiropractors and so on. And then they'll offer programs like 12 months interest-free or 18 months interest-free financing for folks, so they can get the care they need and not have to bear the financial burden all at once. That said, we have really very fair and equitable fee structures, and our whole goal, as I mentioned, is the fastest results for the least cost and the longest lasting benefits. So that's what you can expect from us, and no matter what doctor you see when you come in, you're going to get the benefit of all of us and our collective experience. In other words, if we're not getting the results that we expect with any patient, with any doctor, we will collaborate amongst ourselves. We'll refer sort of, under the same roof. We'll refer to each other, and we will have roundtable type discussions on individual cases when the need arises. So we have all of our collective experience and skill sets brought to bear on your case. We hang our hat on great results and word of mouth, and we've been able to build a really large patient base by purely referral, by pure word of mouth over the last 20 years. And that's what we plan to do for the next 20 years. And so our whole goal is to make sure that you succeed in your endeavors with us. If you do want to become a patient, you just contact the office, ask them to send you a new patient intake. You could always pop by and pick one up if you'd prefer, and send that in, and they will get you scheduled with any one of us. If you have a particular doctor you'd like to see, you can request that particular doc. As I mentioned, you're going to get the best of all of us, no matter who you see in that regard. And with that, that brings us to the end of this new patient orientation presentation, and I really thank you for your time and attention and your interest in our office. And if you think that there is any chance that we can be of service to you, then I hope that you come in and see us down the road. Thank you.